Are you tired of dark pigmentation on your face and you really wanted to get rid of it? So stay tuned with me. In this video, I will share the information about melasma and its treatment. Melasma is acquired hyperpigmentation disorder in which you can see the pigmented spots on your cheek, around nose area, upper lip and chin. So how we are getting this disorder? For that, let's understand the basic pathophysiology. Our skin is made up of three layers. First is the epidermis, dermis and hypodermis. In the basal layer of epidermis, melanocytes are situated, and these melanocytes are producing the melanin pigment. This melanin pigment is responsible for our skin color. If there is the less melanin, our skin is the more fairer, and if there is an more melanin, our skin is the more darker. So because of all the triggering factor which I already mentioned, this melanocyte gets stimulated and start producing the more melanin hormone. In the dermis layer, there are certain pathophysiological changes happen, like there are fibroblast cells are there. There is the inflammation of fibroblast, as well as your blood vessels diameter start increasing, and because of all this kind of changes, your blood vessels become more vigilant on your skin, as well as your melanocytes are also producing the more melanin. Collectively, this increase the permeability of your skin and start giving the darker color. Treatment of melasma is a very challenging and it's very long-term process, and there is a chance of reoccurrence. So how we can manage the melasma? It's highly depend on the severity, duration, your previous exposure, previous treatment. Now let's talk about melasma treatment. We will divide this treatment into the four parts. First one is your photoprotection, second one is your depigmentation, third one is your exfoliation, and fourth one is different kind of laser and antioxidant. So the photoprotection is the most important part of melasma treatment. Whenever you're going out, you should apply sunscreen lotion on your skin. What should be the prerequisite for your sunscreen lotion? It should be the SPF 50, and the quantity should be the length of your two finger. And nowadays for the melasma, different and advanced sunscreen lotions are available that we call the tinted sunscreen lotion. In the tinted sunscreen lotion, there is a iron oxide. This component is present, and this is highly efficient against the melasma. There are different companies: Bioderma, Photostable Gold, and Sunblaze. These companies are providing the good quality of tinted sunscreen lotion. You can use that. 2 to 4% of hydroquinone is a good option for melasma. Basically, it acts against your tyrosinase enzyme, which is responsible for the melanin production. It decreases the amount of melanin in your skin. You should always apply this cream under the guidance of dermatologist, because it can increase the redness, itching, and sensitivity of your skin. And when you're using this cream for the prolonged time, it can lead to the ochronosis. For melasma, there are certain combination creams are available. So the composition of this combination creams are your hydroquinone plus retinoid and different kind of the steroids. But this combination cream can make your skin thinner and can worsen your melasma. So always take the consideration of your dermatologist. Talk with your dermatologist. They will guide you throughout your melasma treatment. For the treatment of melasma in the pharmaceutical industry, we have different kind of skin lightening agents are available, like kojic acid, azelaic acid. We have niacinamide, arbutin, we have tetrahydrocurcumin, and glycolic acid is available. D-melan and Melaglow is a good option against the melasma, which combine almost all the ingredient and giving the good coverage against the melasma. Nowadays, traneximic acid is a good treatment against the melasma, but it can be used only for the short duration, and its effect is also very short. Like if you wanted to go and attend any kind of function, so you can take the traneximic acid intradermal injection. But before that, you should always check, do you have any kind of occlusive disorder? This is highly contraindicated in the occlusive disorders. For melasma, there are different kind of oral medications are available. We have the traneximic acid, glutathione, which decrease your reactive oxygen species, and one newer agent is available, that is the polypodium leucotomus. All these agents are nowadays widely used, but always remember, melasma is not a disease you can just cure with the photo protection or depigmentation cream. No, you have to take all the kind of medication in a combination, then it will give you the proper effect. In the exfoliation, we have different kind of chemical peels are available. Basically, in the chemicals peel, we are applying certain chemical on your skin, so it will exfoliate the upper layer of your skin and it will help to reduce your melasma. In the chemical peel, we can use the glycolic acid, but always remember you need 5 to 6 kind of sitting for to get a proper kind of effect. In the glycolic acid, we have Jessner's peel, yellow peel and TCA peel. This kind of options are widely used nowadays. If your melasma is not getting better by using previously mentioned treatment, so at last we can go for the lasers. In the lasers, we can use the Q-switch laser, which is highly efficient against the melasma. The wavelength of Q-switch laser is absorbed by your melanocyte and they will decrease the production of melanin. While taking the treatment, be patient. This is very slow treatment. To see the any kind of effect on your skin, it will take 6 to 8 months. Thank you so much for watching this video. Stay tuned with me till next video. Thank you so much.